Okay, here we are. We are live. I'm your host, Christina Previtt. You are watching Wake Up Call Live, and joining me today is my very special guest, who you have all seen before, Dr. Betsy Greenleaf. She's a urogynecologist with a practice in Howell, New Jersey. And I will not do your wonderful credentials any justice. So please tell us your credentials, and then we'll go on from there.
Sure. So it's always wonderful to be here with you. I have so much fun talking. So I'm Dr. Betsy Greenleaf. I'm the first board certified female urogynecologist in the country, and which is really exciting because urogynecology didn't really become a specialty until probably about 6 to 8 years ago. And I'm a CEO of the Pelvic Floor Store. I have my own podcast. Body, Mind, Spirit, and I forgot the other ones. Some of your parts, but
Some of your
just
parts, yes.
follow me on social media, and you'll find out more.
Yeah, I love your social media posts. But so I like to say that I'm not a stuffy lawyer, but you are not a stuffy doctor. So
No.
I find a lot of your posts are obviously very informative, but fun too. A lot of really funny stuff. I don't know, like maybe you should have gone into comedy.
I know, and I have so many more ideas. Like, there's these videos I want to do, and it's just trying to find the time to shoot the videos has been funny. But I don't know if you saw the whole Olympic series I did this
Yes,
summer. But yeah, I almost threw my back out when I was trying to pretend to do gymnastics. But
those were absolutely
they came
hysterical.
out funny.
Yeah, and if you don't know what we're talking about, you have to go look at Dr. Betsy's Instagram page. It's just hysterical. So what we're going to talk about today is how your period is the fifth vital sign. That was interesting to me when you just said it a few minutes ago. But what every woman 40 plus needs to know about her period and her body. And when I first asked you to come on and talk about this topic, this is something we've sort of raised before tangentially on some of our other interviews, but it's like I saw in an article that menopause, I hate the M word, but menopause is referred to sometimes as the middle-aged puberty. And a lot of women don't really know what to expect. I mean, you sort of know that this thing is going to come around. Like, maybe you start getting some symptoms in your 40s or your 50s, but you don't actually know what's going to start happening to your body. And it's amazing how there's just doesn't seem to be a lot that we do to let women know what they should be looking out for. So I hope that you're going to share that with us today.
Yeah. Oh, I have. There's not enough time. I have so much to
No.
talk about, but yeah. Well, first things, I mean, the with the period being the fifth vital sign. So vital signs we think of in medicine as like your temperature, your blood pressure, your heart rate, your respiratory rate. These are all different physiologic things that our body does that we can tell if we're being healthy. Like if our heart rate's too fast, maybe the body's under stress. If it's too slow, that's a problem. But a few years ago, they really introduced this idea as the period as the fifth vital sign. And it's because our hormones and the cycle of the period can really give an indication of what's going on in the body. For instance, when the body is under a lot of stress, and that could be like emotional stress or physical stress, our hormones and our energy from our body is diverted away from our reproductive track, our reproductive system and processes. Because in cave people times, when we were like stressed because we were running away from a saber-toothed tiger, that was not the most ideal time to be reproducing. So all of our energy would have been put into developing or producing hormones like cortisol that would help us like get away from that saber-toothed tiger. So in today's modern day, the body doesn't know the difference between, oh no, we're running away from a saber-toothed tiger, versus we have a lot of pressure and stress because of we're doing too much, we got too much on our plate, we're trying to balance too many things. And so we will start to actually make those stress hormones, and it sucks away our sex hormones, which control the reproductive system, our periods, our sex drive. So in women who are like still menstruating regularly, that if you all of a sudden you developed kind of changes in the pattern of your cycle, that could be a sign that there's something else going on, whether that's emotional stress affecting the hormones or physical stress. Because if we'll also see people periods get thrown off if they have an illness. An interesting fact, God forbid, I'm going to say the COVID word, because I know that everyone gets like kind of uptight when we say COVID or vaccines, and I'm using both of those words right now. There has been, I've seen amongst my patients, a lot of complaints of their periods being thrown off from either one of those, either the vaccine or the actual virus. And there's really no data on this, but there this week I saw that there is an organization that's going to start studying this, because I kind of been noticing it and hearing it amongst my patients, but I'm like, I don't have any like scientific studies to back this up. But I'm really looking forward to finding out what happens with this official study that they're going to do, looking at both COVID and the vaccine. But both of those are stressors on the body, so it would make sense that they would affect the period. So
oh, that's interesting. I haven't heard that. So people are it's disturbing their normal cycle, like maybe late, or they're missing periods.
Exactly. Or sometimes even I've had people say that their periods are either heavier or lighter than they used to be, but there's some sort of change. And it just makes sense physiologically that anytime the body's under stress, that you would see some of these changes with the menstrual cycle. So, and now when you're talking about women who are now kind of getting to the end of their menstrual periods and now entering that perimenopause phase, now everything goes out the window, because you may, some people are good in that their whole lives are regular. Some people with different medical conditions like polycystic ovarian syndrome will get their cycles will be all over the place. But almost everybody, once they start hitting that perimenopausal period, the cycles just get completely crazy. And it's a really difficult time, because especially if you're somebody that's been using your cycle to know whether you're pregnant or not, all of a sudden this can cause a lot of stress when all of a sudden you're like, okay, wait a minute, I didn't get a period this month. Like, what's going on?
I'm 50 and pregnant.
And that's a scary thing, is that you can still get pregnant. So, a lot of what's happening, during this time is that the hormones are starting to wind down, and we're coming to, I don't like to say an end, because it's really a new phase, but we're kind of coming to an end of that reproductive phase of our lives. You were talking about the word menopause before. I always laugh at it. I'm like, there's nothing being paused. There's like, I don't know why there's have
nothing
that.
About men either. So.
Yeah, like there's nothing being paused. But I also don't like to look at it as an end, because then that can be kind of traumatic. But in Japan, the word that they use for menopause translates into second spring. And I like that idea, because it is a rebirth. It is this new phase of life. And it can be very exciting, but we don't in America talk about it. We're just getting to the point where this is now becoming a topic that of interest as well as the population ages, and there's more of a demand to be like, well, what the hell is going on during this period of time?
Well, let's define when it is too. I mean, I referenced 40 plus in the promo that I did for this show, but what age are you really talking about when we start talking about perimenopause?
So, perimenopause can actually even start as early as 36, and that can be considered normal. Sometimes I'll have patients come in that have gone through it at that age, and they're like, oh, I went through an early menopause. Actually, that's still considered within normal ranges. Usually, like on average, though, like 48 to 50 is kind of like a national average, though it can be even much later. I mean, in fellowship, we had a woman who was in her 80s who was still getting regular cycles. Ugh. And so, yeah, I know, which if you think about can be very scary, because at 80 something, she could have potentially still gotten pregnant. So that would have been quite interesting. So
well, that would definitely be a geriatric pregnancy.
yeah.
I know you don't like that terminology, but
yeah. So we're born with all the eggs we're ever gonna have. We don't make any new ones. When we hit puberty, now every month, our hormones in our body tell the body to release an egg, and then the egg. This is like the menstrual cycle. If the egg doesn't get fertilized, then the lining of the uterus, which had built up all month long in preparation for a pregnancy, will now slough off. That's your period. So it's a combination of blood and tissue, and that egg kind of either disappears or gets sloughed off. So what's happening during that perimenopausal period is the ovaries are now kind of getting a little lazy-ish, or we're just kind of like running out of our reserves. So we're not necessarily ovulating every month. And so what happens is now the cycles kind of get a little weird. They might not be every 28 to 30 days. Sometimes they may be like every 2 weeks, which can be very frustrating, or they can space out to months at a time. To be officially in menopause is you have to go a full month without not a full month, a full year without a period. And then that's the definition of menopause. So if you go 11 months and all of a sudden get a period, now you just set your clock back. So
you have to start all over again.
But you can also go 12 months and now you're officially menopause, and then down the road have bleeding again. But the problem is you can't be like, oh, that's my period, because sometimes bleeding can be the first sign of a problem with the uterus. It can be something called endometrial hyperplasia, which is just the thickening of the lining, or even uterine cancer, which would be more serious. So any abnormal bleeding, I always recommend people, it's better off to get checked to make sure that's nothing more serious.
So when you go through menopause, would you still recommend that women still get an annual pelvic exam?
Oh yeah. So definitely. I mean, that the pap smear recommendations keep changing, but the actual recommendation for pelvic exams really should be every year, despite whether you need a pap smear or not. So, interesting enough, if you've made it to the age of 70 and never had an abnormal pap smear, the current recommendations are you don't need them anymore. But a lot of women translate that as, well, then I don't need to go to the gynecologist anymore. But there's other things that we're looking at. We're looking to make sure that there's no visible growths or tumors or dropping bladders and dropping uteruses, and because things can, unfortunately, gravity affects everything in our lives. So just as those boobs are starting to head south, sometimes those bladders and uteruses can drop too.
Yes, when I interviewed you in the past, we talked about I forget what you called it, but basically your uterus has like fallen out.
Yes, it's fallen and it can't get up, unfortunately.
Collapsed uterus, I think, is what the term.
Yeah, so there's still other things that we're checking other than just the pap smear, which is a screening for cervical cancer. But
okay, so ladies out there, you're not going to get rid of going to the gynecologist. So let's say, for the ladies that are watching, you're in your 40s, you're going about life, you're just minding your own business. And maybe you're not even thinking about menopause, right? Because I don't think about it a lot, except for when I start to have like weird things going on and I'm like, oh, maybe this is hormonal. Like maybe this is my body like getting ready for, what's down the road. So can you tell us some of those things that women in their 40s might be experiencing that are kind of like hints of menopause down the road?
So one of the things is, like we said before, is that period getting a little like wonky, to use a medical term, is that it's just throwing off the cycle. The other things we start seeing is the way our hormones are not just hormones that affect periods and fertility. They're actually neurotransmitters. So they affect our brain. So you may notice some increased forgetfulness, kind of some brain fog. That tends to be a big complaint amongst perimenopausal and menopausal women. Women who've been pregnant may also tend to have those same, we always call it pregnancy brain. It's how the lack of hormones kind of affect the brain during pregnancy is kind of saying a similar thing. If you've ever been pregnant, that's happening in perimenopause and menopause. You just kind of like things just don't feel like they're clicking. Hot flashes, definitely. Everyone thinks of hot flashes when they think of menopause. And I will tell you, I had a hysterectomy when I was 41. And even though as a gynecologist, I'm like, oh yeah, hot flashes. The first time I had one, I was like, oh my God, this is what they're talking about. But if you haven't had one before, I can't explain it until you actually have one, but it's like this fire that just kind of starts slowly, and then all of a sudden it's like this all consuming fire that just takes over your body, and then it happens for like a minute or so, and then it goes away, and you feel like you want to rip off your clothes and jump into the freezer because you get so hot. But then here's a fascinating thing is your body temperature doesn't actually change. And the other fascinating thing they found with hot flashes is not everybody gets them to that degree. It all has to do with your inner thermostat, and so how your body perceives temperature. So if you're somebody who kind of like doesn't is more sensitive to like cold and heat, you may be more sensitive to these temperature changes in the body. But like I said, our temperature doesn't actually change. They found that there's a group of nerves in the brain that sense temperature. It's kind of this thermoregulatory area, and it senses and gives feedback on temperature, and it's that area of the brain that gets stimulated, and so you perceive yourself as being hot and sweaty when you're actually not. So some of the newer medications that they're now researching are actually going to be geared towards affecting that thermoregulatory area as opposed to using hormones. So it's a kind of fascinating thing.
That is interesting. But what about, I've experienced this before once or twice, is I've heard women say that in the middle of the night, they'll just wake up and be in a complete sweat.
Yeah.
I mean, that's real. So
Night,
what's that from?
night sweats also tend to happen. That's a combination of that thermoregulatory center and also cortisol. So we naturally get cycles of cortisol, and a lot of women, especially in perimenopause, specifically if I hear them saying like, oh, it's happening between like 2 and 4 o'clock in the morning, or usually a lot of people complain around like 4 o'clock in the morning ish, they're getting this. So it's a combination of what your cortisol is doing, because your cortisol tends to be the lowest that it's going to be at that time. So it's just this effect, and they don't really even know for sure what causes it, but that's just some of the theories. The other unfortunate thing that happens with menopause is vaginal dryness, and so that can be quite uncomfortable when it comes to sexual activity. And not just that, but we get a thinning of the vaginal tissue that now makes us more susceptible to recurrent urinary tract infections and recurrent vaginal infections. And these are all kind of combined with the lowering of estrogen in our systems.
Well, that sounds fun too.
Yeah.
So these are all things that somebody in their 40s might experience.
Mm-hmm. And then going forward. So.
Oh God, it's just, why did God do this to us? It's so unfair.
So
do they get it? Maybe that's another show.
Well, you know what? Apparently they do. They call theirs andropause now. And we see, well, that's the thing. You see tons of commercials on like, have you got low T? You don't see tons of commercials on TV like have you got are you going through menopause? Like
well, actually, you and I had talked about this on another episode, and I was very happy to hear this. But a lot of women still believe that taking estrogen supplements causes cancer.
Yeah.
Can you talk about that?
Yeah. So I trained when the Women's Health Initiative study came out, and that was a study where they looked at women on hormone replacement. Because prior to that, actually in the 1960s, there was a doctor that wrote a book that basically touted hormones as being the fountain of youth. And so everybody went on hormones. It was supposed to protect our hearts. It was going to keep us young. And then all of a sudden, the Women's Health Initiative came out probably in the late 90s. And in their study, they were like, oh, stop. they actually stopped the study because they saw an increased risk of breast cancer and heart disease in the women that were taking both estrogen and progesterone together. So now, fast forward how many years, we're now looking at that study and going, wait a minute, there may be some things that were a little bit flawed in that study. Number one, it was the women who were in the combination estrogen and progesterone. That was the biggest thing. It was also done on the population that was used in the study were older, so they may have naturally had some of those risks. But the biggest thing that I think was the problem is the hormones that were used in that study were synthetic hormones. And so synthetic hormones are not processed in the body the same way as our naturally occurring hormones, and that actually these synthetic hormones have toxic metabolites, so they're broken down in the body and they can produce these toxic metabolites, which in turn can increase the risk of cancer in certain populations. So it depends on how you metabolize your hormones.
So you can safely take estrogen.
So, I think it all gets looked at, basically patient to patient, family history, you want to take all those kind of things into consideration. Though I don't like using bioidentical because I think bioidentical has gotten a bad name. I like using bioequivalent because there are hormones that are prescription. That's another falsehood. People think that these bioequivalent hormones have to be compounded. They can be compounded in compounded pharmacies, and some insurances don't cover that. But there are some bioequivalent prescriptions that are out there too. They tend to be much less inflammatory. They don't tend to produce those toxic metabolites. But the other thing we have to remember is that hormones themselves don't necessarily cause cancer. We're making cancer cells in our body all the time. Our immune system is attacking them and breaking them down. Unfortunately, every once in a while, you might have a cell that just gets through and just doesn't get taken care of by our immune system. And now sometimes when you expose it to things like hormones, if a type of cancer cell that has receptors for that hormone, now it can promote that cancer, but it's not necessarily causing it. So,
Okay. That makes sense.
The bioequivalent, if you had to choose between hormones, the bioequivalent ones are better.
Man. So you had said in another show that these symptoms that women might experience, that they are completely reversible.
So, well, yeah. I mean, if you go on bioequivalent hormones, you can basically put off that menopausal period, time. So, we can now basically give hormone replacement to support the body, help with brain fog, help with hot flashes, help with vaginal dryness. So there are some really great advantages of actually using hormones. The other thing that we don't talk about with bioequivalent hormones is it actually helps to reduce the risk of osteoporosis. And in the WHI study, they kind of hush this, but not just osteoporosis, but also protective against colon cancer. So the hormones can actually help with that.
Well, so then that's comforting for me, and hopefully for anybody else who's watching that is just as worried about the M word as I am. Just the little taste of symptoms that I've had thus far, I'm like, oh, this is not.
I think the thing that's unfortunate is, so myself as a gynecologist, I didn't have all this information when I had my hysterectomy. I had it still when everybody was really scared of hormones, and like doctors were taking their patients off their hormones left and right. And because we were scared, like we don't want to cause cancer, we don't cause heart disease. But the newer studies actually showing that the sooner you get on hormones, actually the better, that it can be protective. And so I unfortunately suffered through hot flashes and moodiness and sleepless nights for about probably 5 years before I got to the point where it was like water torture. I was like, that's it, I can't take it, just give me whatever, I don't care if it causes cancer, just give me hormones, I can't take it anymore. And so if you don't get on hormones within that 3-year window, you actually can lose some of the long-term health benefits of being on hormones.
Oh, that's good to know. So
So,
when should you start taking those? Like the
you know,
first month or?
that's where it becomes a little bit more tricky, because the studies were like, okay, you got to be in within 3 years, and I think they're usually counting it from the end of the period, from when like you've gone a full year without a period. But
Okay.
going on within that perimenopausal, sometimes it even helps with those symptoms, because perimenopause, that's tough, because everyone's like, well, check my blood levels and tell me when I'm going to have menopause. Unfortunately, it doesn't work that way. I wish it did. We can say like, all right, based on your hormones, it looks like you are in menopause, but that doesn't physiologically always match up with what's happening in the body. So menopause can, from the time you hit that perimenopausal time, it can take months to, it could take years. So 8 years can be considered normal of that going through that stage of irregular periods and moodiness and all that stuff. So
What if you're on the pill? I mean, does that interfere with
it does. And
what you'd be seeing?
I'm always really torn about the pill, because I, was on the pill forever until I had kids, because there are advantages to the pill, because the pill prevents ovulation. And so we know that actually is protective against ovarian cancer. But I get torn with the pill, because we also know they're all synthetic. All the pills have synthetic hormones in them. There's not a bioidentical pill. I wish they would come out with one, and I hope in the future they will. So we know that the hormones that are used for the birth control pill are very inflammatory. They're the ones that have toxic metabolites. So now, yeah, this is where I get torn, because I'm like, ideally, I would rather people not be on it. And especially as we age, it would probably be better not to be on it. But at the same time, that perimenopausal period, even beginning of menopause, you can still potentially get pregnant. So the problem with the pill is it's going to mask a little bit of that perimenopausal symptoms. So we're not going to know 100%, because you may still get a withdrawal bleed with the way the pill works. So the way the hormones are, and then you get that the placebo, that drop off, you get a period. So it's hard to say what's going on during that time period. My personal preference, and there's so many different options for birth control and hormones nowadays. My personal preference, if somebody needs something for hormones, I like the IUDs. I mean, if they need something for pregnancy, I like the IUDs, because you're not getting that systemic exposure to the hormones and the synthetic hormones from the birth control. But if, like, during that perimenopausal, you could use like an IUD as a great option to prevent pregnancy. And also some of the IUDs have progesterone in it, which actually will help protect the lining of the uterus against uterine cancer. And then using a combination of bioequivalent hormones to manage the other symptoms.
Is
So,
there one in particular that you recommend?
they're all pretty much the same. So, and there's so many different options now with the IUDs. And the nice thing about the IUDs is if there's a problem, you just take it out. So, they're placed in the office. I will tell you that it is crampy. I'm not going to lie. Like, it can be very crampy to put that in. And sometimes people experience cramping for anywhere from days to a couple months afterwards. It depends. I think most people, it's like a week or two if they have some kind of crampiness.
Is that doctor code for pain?
I know. I wouldn't say it's pain, but I would say it's definitely not comfortable.
So, well, they have to dilate you, don't they?
Yeah.
Oh God.
Yeah. So,
well, it's either take the synthetic hormones or have some. Well, I have never had a child, so I guess if you have a birthday child, this will be nothing. You could do it very easily. Oh gosh.
Yeah.
So is there anything else that is, comes top of mind for you that you would want to offer us as a public service announcement?
So just in general, like, to manage any health symptoms, and especially that perimenopausal period, going back to basics is probably the best option. And when I say basics, drinking enough water, because 75% of Americans are chronically dehydrated. That's going to make anything you're feeling 10 times worse. So get more fluids in. Everybody, all of us, we all need more fluids. Getting more sleep. That's going to make inflammation. That's going to make moodiness. That's going to make things 10 times worse. Shoot for 8 hours. I know it's not the easiest thing, but if you can just back it up every day by 15 minutes until you're getting the 8 hours of sleep, that's perfect. And then exercise and eating healthy. So really, those are really the biggest 4 secrets to health. So
it sounds pretty basic, right?
yeah. And it's, it's something I think a lot of us overlook. And stress reduction. So I'm a big proponent of meditation. And I have to say, like, it's not always the easiest thing, but there's so many different options now, from free guided meditations on YouTube to I love my Muse headband, which is this really cool headband that works with an app, but I'm a gadget person. So so there's amazing courses. There's so many different things for meditation, but there's really some amazing information on the health benefits and even on hormones and meditation. So
awesome. Well, I will check those out. And as always, I'd love to have you on again, because there's never a shortage of topics to talk about.
And then make sure you follow me if you are not already follow me on social media, because in the spring or later, we haven't set the date exactly, sometime in 2020, we're going to be doing a free summit called the Happy Vagina Rally. And
did you mean 2022?
Oh, it's 2022. What did I say?
2020.
2022. Oh my God. See, I'm still, ever since coronavirus, I'm like stuck in 2020. I don't know what it is. I mean, like the world came to a halt and I got stuck in 2020. At 2022. Thank you for correcting me. Yeah, we're going to do the Happy Vagina Rally, and I have at least 30, if not more, speakers. Right now, it was supposed to be a 3-day free summit on perimenopause and menopause, but it may actually be longer because I have so many speakers that are going to be part of it.
I'll be looking for that. I will post that on my social media platforms, because that sounds very interesting.
Yeah.
And I also posted a link to your website. It's greenleafbewell.com. I don't know why our names are not showing up here, but you can find her website in the comments. And I will also post links to your Instagram page. And, as
long as I don't get kicked off of Instagram again.
I know. Isn't that crazy? You got kicked off Instagram because you used the word vagina? Was that it?
Yeah.
It's just so crazy. It's just so ridiculous. I can't even believe it. But thank you again for giving me your time and your expertise. I always enjoy these conversations and would love to do it again in the future.
Oh, it's so much fun. Thank you so much, Christina.